Greetings, everyone. We are hosting live from our Chicago and Seattle offices, and we're excited to share the important trends facing philanthropy. I'm here with my colleagues Peter Fissinger, President and CEO, Campbell & Company, and Kate Roosevelt, Executive Vice President at Campbell & Company. And we are joined by our esteemed panel, Karen Ahuja, Chief Executive Officer of Philanthropy Northwest, Rob Henry, Vice President of Education at CASE, and Randy Barju, President of Advocate Aurora Health Foundations and Chief Development Officer of Advocate Aurora Health. On behalf of everyone attending today's webinar, thank you for sharing your insights and experience with us. Before we begin today's presentation, I'd like to quickly review some logistics for those of you who may be new to our webinars. To ensure that you have the best webinar experience possible, please follow these tips. Close any programs other than GoToWebinar, of course, that are running on your computer. Call in using a telephone instead of using your computer speakers. We will be playing a video during this webinar. The video audio will be playing through your computer speakers, not the telephone. So please make sure your computer is unmuted during this time. And if you experience any visual issues, send a chat to Campbell & Company. You may also contact GoToWebinar at 1-800-263-6317. Finally, today's webinar will last about 75 minutes, and you will earn 1 continuing education credit, and that is good for your participation with CFRE International. We won't be sharing slides from today's presentation, but we will be sending a link to the recording in a follow-up email from GoToWebinar. We welcome questions during the session, and if you are willing to be unmuted, we will ask your question live. Please send your questions in advance by using the question pane to your right. And make sure to follow us on social media using hashtag GivingYourSay2019. We will be actively posting throughout the week. And so now I would like to take a moment to introduce Peter Fissinger and Kate Roosevelt. In his 25 years with Campbell & Company and throughout his 35-year career, Peter Fissinger, President and CEO, has served as an advocate and student of generosity. He is a second-generation fundraiser with a lifelong commitment to collaborating with donors and nonprofit organizations to advance critically important missions. Peter has worked to help Campbell & Company evolve from a fundraising consulting firm to a diversified professional service firm addressing the full scope of institutional advancement needs of the nonprofit sector. A frequent speaker and writer on philanthropy and generosity, Peter serves as Vice Chair of the Giving Institute and is a member of the Executive Committee and Board of Managers of the YMCA of Metropolitan Chicago. He is a graduate of the College of Holy Cross. Kate Roosevelt, Executive Vice President here at Campbell & Company, brings to her work more than 20 years of experience in the nonprofit sector and a deep belief in every organization's power to make an impact. With strategic vision and a collaborative spirit, she leads Campbell & Company's Northwest and West region teams. In her client work, Kate's intelligence and calm in the storm guidance have helped nonprofit organizations raise hundreds of millions of dollars through a variety of campaigns and special initiatives. Prior to joining our firm, Kate worked on various projects as an independent fundraising and management consultant. She served as Executive Director of the Washington Wildlife Recreation Coalition and Associate Director of the Cascade Center for Public Service at University of Washington. Kate regularly presents on fundraising topics at local and national conferences and is an active member of the Association of Fundraising Professionals Advancement Northwest. As a volunteer, Kate is a trustee of Colby College, her alma mater, from which she holds a Bachelor of Arts in American Studies. She is chair of the College Resources Committee and a member of the campaign cabinet for Colby's $750 million Dare Northward campaign. In the Seattle area, she has served in board leadership positions for several conservation and affordable housing groups. Kate also holds a Master of Public Administration from the University of Washington. And with that, I would like to turn over to my colleague, Peter Fissinger. Peter?
Thank you very much, Sarah, and I want to extend my welcome to everybody who's joined us for this webinar this afternoon. We have been doing this, I think, for close to 15 years now and always get somewhere between 700 and 1,000 people to register, so we know that you're interested to hear the data. We have prepared a video to cover the data this year, and then after the video that presents the findings, I'll make just a few comments before I turn it over to my colleague, Kate, who's going to talk with our panelists about what the data means and give a deeper dive into some of the sectors that our panelists represent. We know from your feedback that this is the portion of the webinar that you love best, so we're working to get to that portion of the webinar as quickly as possible. Sarah, can you play the video for us, please?
A strong economy, an end-of-year stock market drop, the complexity of tax reform and public policy. 2018 had its highs and lows. How did philanthropy fare? Each year, the Indiana University Lilly Family School of Philanthropy conducts the research for Giving USA, which the Giving USA Foundation publishes. Giving USA reports on the sources and uses of charitable giving in the United States. Campbell & Company is proud to support these efforts as a Giving Institute member. According to the data, total charitable giving reached $427.71 billion in 2018. That's over $427 billion flowing to our communities and energizing our economy. What does it mean for the nonprofit sector now? Let's break it down. From 2017 to 2018, total giving increased 0.7% in current dollars. When we take inflation into account, total giving dropped by 1.7%. There have been some dips along the way, but giving has grown for the better part of 4 decades. People propel philanthropy, though giving by individuals continues to decline as a percentage of total giving. Giving through donor-advised funds and family foundations likely accounts for most or all of this change. In 2018, individuals made up 68% of total giving, while foundations accounted for 18%, bequests for 9%, and corporations for 5%. When you include bequests and family foundations with individuals, the share of philanthropy powered by people rises to 85.7%. Giving by source was mixed. Giving by foundations and corporations increased thanks in part to the robust economic environment. Giving by bequests posted no change, and giving by individuals declined slightly. After growth during the first 3 quarters of the year, the S&P 500 fell 13.97% in the fourth quarter, ending 2018 down 6.2%. This volatility could have played a role in individuals giving less, along with other factors such as tax law changes. When we look at giving by type of recipient organization, religion still accounts for the largest share at 29%, although this piece of the pie has been shrinking for several decades. Next came education, followed by human services and gifts to grant-making foundations, health, public society benefit, and arts, culture, and humanities. International affairs, environment, animals, gifts to individuals, and unallocated giving made up the smallest shares of total giving. After a strong 2017, recipient organizations saw uneven results from 2017 to 2018. Giving to international affairs and environment animals posted substantial growth, influenced by disaster giving and increased awareness around environmental issues. Giving to arts, culture, and humanities, health, and human services stayed relatively constant, while education, religion, public society benefit, and foundations experienced declines in giving. But if we zoom out, we see a different story. All sectors experienced positive 2-year growth from 2016 to 2018. Following such a robust 2017, many of these declines in 2018 could be a course correction. The economy has long been an important predictor of charitable giving, and this held true in 2018. Disposable personal income experienced healthy growth in 2018, and individual giving was 1.9% of disposable personal income. GDP grew substantially in 2018, with a 5.2% increase in current dollars compared to 4.2% growth in 2017. Total giving made up 2.1% of GDP, similar to previous years. 2018 was a complex year for charitable giving, with many countervailing forces playing a part. Strong economic growth likely had a positive impact, while the S&P 500's dramatic plunge in the fourth quarter of 2018 may have depressed giving during the critical end-of-year push. Tax reform and the complex policy environment, from trade to state and local tax deductions, contributed to uncertainty. While total giving increased slightly in current dollars, reports have pointed to the decline in broad-based giving. From 2000 to 2014, the share of Americans making charitable contributions decreased by nearly 11%, according to research by the Lilly Family School of Philanthropy. At the same time, the use of donor-advised funds continues to grow. According to the 2018 DAF report published by the National Philanthropic Trust, both contributions to and grants from donor-advised funds reached all-time highs in 2017. As we face rising income inequality and uncertainty around tax reform and public policy, where is philanthropy headed? The nonprofit sector must continue to make the case for its vital work and for the broad-based philanthropy that has traditionally supported it. Campbell & Company will be there each and every day, helping organizations advocate for charitable giving and move their missions forward. As nonprofit consultants, Campbell & Company tracks and intercepts trends that impact organizations across America. Check out our website at campbellcompany.com for more analysis of the Giving USA data. To buy Giving USA materials, visit givingusa.org and use the code CAMPBELL for 30% off.
So we are honored and delighted, as Sarah mentioned in her introduction, to have the benefit of the wisdom and experience of three leaders in the philanthropic sector from across the country joining us today. Karen Ahuja, who is the CEO of Philanthropy Northwest, Rob Henry from the Council of Advancement and Support of Education, and Randy Varhu, the President of Advocate Aurora Health Foundations and the Chief Development Officer of Advocate Aurora Health. So I just want to take a minute to thank you all for joining us today. And the purpose of engaging these three leaders today is twofold. One is to hear their expert perspective on the data overall, and perhaps even more importantly, to have them ask them to help us connect the data with their real life experience and the experience of their constituents and stakeholders on the ground, so to speak. So given what the report tells us this year about the state of giving as it relates to foundations and corporations, education and health, which of course have always been two major drivers of philanthropy in our country, we're just delighted to have the three of you with us today, and thank you for your time and participation. So I think to get us started, what I would love to do is to go ahead and ask the three of you to give us a brief introduction to who you are and what you do during the course of your day in the philanthropic sector, and then we'll dig into some questions that will allow all of us to reflect on the data and again even provide some additional context and insights there as well.
So this is Peter, and I just want to make a couple of comments before we move to the panel discussion. There's just so much to unpack in that video. Just starting with the total, $427 billion. Nominally, it's up slightly, 0.7%, but when adjusted for inflation, giving was actually down a little bit this year. Interestingly, if you go on the Chronicle Philanthropy daily website, they are calling giving down slightly over last year. And if you go on the ASP website, they are saying that giving is up slightly a little bit this year. So there's a lot of complexity here. The economy is broadly up. The GDP and personal income both up, but the S&P 500 down, especially in the fourth quarter. Some categories of giving are down, but when you account for the two-year trends, you'd see in human service, education, public society benefit, and foundations, they're all on an upward movement. So do we call this long-term growth, or do we call it being down a little bit this year? Then the public policy impact, really, I would say still not known. The Lilly Family School of Philanthropy estimates that giving could drop by as much as $20 billion just based on the fewer number of people who will itemize on their taxes. And that's estimated to be 15 million rather than 45 million the prior year. They say that in order to see that drop, everything else has to be held constant. That's the way academic research works, but that's not the way our world works. So it's going to take some time to see what the impact of that is. corporate giving went up. On one hand, it remains at around 1% of pre-tax profits. On the other hand, some people speculate that there may have been some increased corporate giving based on the new capital available to corporations with their tax rates down. We know that the number of households giving, as counted in this and other kinds of academic research, is down. And yet, are we not capturing the broader acts of generosity that happen in society today? Is this data still viable to capture all aspects of generosity, or as we have, do we need to continue to work on it to make sure that it accounts for things that perhaps the data didn't account for 10 years ago? And then finally, this continued migration of individual giving to family foundation giving and donor-advised fund giving is really captured in the data and in this video. So those are some of the larger factors. And Kate, I know that you're going to try to unpack this further with our panelists. So let me turn it over to you, my friend and colleague.
Oh, Kate, we can't quite hear you yet.
Good morning. As my web camera wakes up and I turn my my phone back on here. Great to be with all of you from Seattle, Washington. And again, I'm delighted to welcome Karen, Rob, and Randy as our expert panel today. And what we'd love to do just to kick things off here is to ask each of you to say a few words about your work and just to give us a sense of what you think about all day and what you're doing in the broader field of philanthropy. So Karen, we'd love to hear from you to get us started. Thank you. And
yes.
Please, yeah, there you go. There you are.
Hi, everyone. It's great to be here, and it's just really wonderful to hear all about the data and where things are going. And I should mention, for those who are on video, I've got this interesting collage of folks behind me, which is an ongoing joke with my staff, that their eyes are always upon me. So don't get freaked out. It's just me in the office, but a constant reminder that they're always keeping me on my toes. So, okay, with that, my quick official introduction. I'm the CEO of Philanthropy Northwest. Philanthropy Northwest is a regional network of foundations, corporate giving offices, banking institutions, and other grant-making entities. And we represent a 6-state region. We are among many other regional associations that exist across the country, as well as issue-based grant-making organizations that are organized by issue area. We organize lots of different programming for our members. We manage funder tables, network subgroups divided by region and topic, and we also hold an annual conference that draws a lot of our members together, which is a great way for them to be sharing the work that they're doing in their different states, many of them rural-based, which oftentimes presents challenges around, isolation or, being able to pull in more resources into their communities. I will mention that, we're a 40-year-old organization, but I would say within the last 5 to 10 years, we've definitely been spending more time around programming focused on equity, or what we call DEI, diversity, equity, and inclusion, and around civic engagement and democracy, and just building a greater policy presence in the sector, and what we think more of our members and foundations and the sector itself need to be doing. And then I'll just say, really trying to lean in a bit more on other thought leadership around impact investing and trust-based grant making. Finally, I am very new to the sector. I have been a nonprofit executive director. I've been a civil rights litigator. I have worked on policy issues, mostly at the national, federal level. So it's great to kind of be on this side, just taking a look at things and taking those experiences that I've had along the way. So thank you, Kate.
Thank you, Karen, and wonderful to have you with us today. Rob, welcome. Rob is joining us from CASE, and we'd love to hear a little bit about what you're up to these days, Rob.
Well, thank you, Kate, and thank you for giving me 30 minutes to do my personal introduction. Similar to what Karen had said, CASE has been in existence for over 40 years. We are a trusted in the advancement space. We currently have over 3,700 members in 82 different countries, and we are currently serving over 85,000 members. As some of you may know, CASE just embarked 3 years ago on a really exciting strategic plan on reimagining CASE, which really looks at 4 key pillars. One is global impact, member engagement, thought leadership, and talent management. And so we're really excited to be here. A new program that we've created that some of you may be aware of is AM Atlas, which really sits in alignment of a lot of the work and the conversation that we're going to have today. So thank you, Kate.
Thank you, Rob. And Randy, welcome to you as well. There you are, joining us from Advocate Aurora Health. So I'd love to hear a little bit about what you're up to these days.
Thanks so much, Kate. It's great to be a part of this panel and looking forward to interpreting some of this data. It's just interesting to see it firsthand, but a little bit more about the role that I serve and perhaps the insight that might be part of the conversation today is I currently serve as chair of the Association for Healthcare Philanthropy, in addition to representing the Advocate Aurora Health System. Advocate Aurora is newly merged, probably just over a year ago. I think April 1st was the 1-year anniversary of 2 very healthy, large systems merging together to form a 27 hospital system, both in Illinois and Wisconsin. Makes us the 9th largest health system in the nation, with 500 total sites of care, 70,000 associates, and 3 million unique patients annually. So you can see that as healthcare changes, we continue to grow, and I think Advocate Aurora will continue to grow with both ongoing integrations, mergers, acquisitions, perhaps non-traditional partnerships. It really just is a dynamic field to be in, and I'm looking forward to being part of the conversation today and addressing whatever questions come forward. So thanks so much.
Thank you, Randy. So I think for those of you who are with us today, we're going to spend the next half an hour or so digging into some questions about the data. Again, inviting each of our panelists to connect the data to their lived experience, so to speak. And we will have a couple of opportunities along the way for you to also pitch your questions to our panelists. So if there's something on your mind or a follow-up question that you have for one or all of the panelists, please send that via the instructions that Sarah has shared with you, and we look forward to fielding as many of those questions as we can this morning. So I think to kick us off, as Peter shared and the video clearly conveyed to us, 2018 was an extremely complex year in terms of giving in the United States. A year that certainly was affected by the economy, by the markets, by the policy environment. The first year in which we were really able to sort of take in at least the initial effects of changes to the tax code and so on. And so I think this living with the complexity and trying to make sense of the complexity is maybe our first task this morning. So I'd be really interested to have each of you share with us sort of your top line takeaways from the data and trends that you're seeing. And Kieran, starting with you, the news as it relates to the foundation sector is, again, mixed and complex, right? We know that giving by foundations increased fairly significantly by 7.3% in current dollars, and at the same time those giving to foundations and the amount of money given to foundations actually dropped by 6.9%. Corporate giving was up again this year, and especially corporate foundation giving was up. So a slightly more positive picture there, but just would love to hear your thoughts on how the national action is syncing up with or not with what you and your colleagues are experiencing here in the Northwest and in other parts of the country as well.
Sure, thank you, Kate. Let me tackle first the piece around just the uptick in giving by foundations, and then I can go to the other piece. But I think you're right. We're also seeing that many of the foundations that we work with are benefiting from a robust market, and I think that's been the case for a number of years right now. And so we are that 5% payout is very healthy in proportion to their assets, including some that are going beyond that. And I wanted to just share with you some stats that I have with an upcoming report that we're going to put out, our trends report, that will happen later in the fall, specifically for the Northwest. And these data are a little behind what you all were providing. So it's really from the latest from 2016, but I think what it does is that it really does confirm this trend that we're seeing. So I'll just give you a little bit of a feel. In our six-state region, we have 7,400 corporate, private, and family foundations, which contributed about $3 billion. And the largest segment of those funds are coming from family foundations. So that's really almost over 40%. We're seeing that giving increased in a matter of just 2 years between 2014 and 2016 by almost 20%, which is pretty significant. And the highest increase in that same period was coming from community foundations and corporate foundations. So again, to this point of that we'll talk about a little later, I hope, which is around DAFs and the impact on community foundations. The highest priorities here in the Northwest, which is great to have my colleagues on this webinar, are education and health. And I think it's really interesting what we're going to hear from Randy around the health conversion foundations. That's happening quite a bit in the Northwest, and that is moving a lot of resources into our communities. So that's a feel of kind of the Northwest and really kind of how our sector is really benefiting from having significant assets. I think your video alluded to, this larger dynamic of income equality and where wealth is residing, and we're seeing that play out and the kind of giving that's coming out of foundations and individual donors. But I think that begs the larger question, of course, of what does that mean as far as making sure that the nonprofit communities are able to really manage the kinds of issues that they're being faced with. I will mention just a couple of things that are also taking place. Of course, we are seeing many of our members, our corporate foundations, are doing larger payouts because of the tax reform law. So we've seen several announcements from Boeing to JP Morgan to others around larger investments, even Microsoft, larger investments that they're making. And those announcements happened at the end of last year or even this year. I'll say there's this other dynamic that's taking place outside of this frame of like how the market is doing or where the wealth is residing. And that is really this broader conversation that I believe nonprofits are pushing with their partners and foundations around really encouraging a larger payout beyond the 5%. So we're seeing some of our members do that. We're seeing also many of them think through different kinds of models around sunsetting and really deciding that it is their impact is felt if they can just spend down and then close shop, but really trying to make an impact in a shorter period of time. And I do think that my final point on this is that over the last few years, especially, and it'll be interesting to see what my colleagues think, is that you're really seeing more of an impetus from foundations to having to respond to what's happening in the environment, the pressure and call to action that they're hearing from many of their grantees around the ways they want foundations to be supporting their work and the kinds of issues that they're working on. So it's creating a really, really interesting ecosystem for the philanthropic sector right now.
Wow, clearly. Thank you so much, and really interesting to hear the correlation between the national data, the Northwest data, the growth in the Northwest, and then just how dynamic the foundation and corporate grant-making ecosystem is right now, and some of the big questions that are coming to the fore, given as you said, the continued accumulation of assets and how best to put those to work for the benefit of humanity. So thank you for sharing those initial thoughts. Rob, it'd be great to hear from you how the data as they relate to the education sector resonate with you through the CASE lens. And I know that CASE obviously is collecting and sharing its own data as well. So what are your takeaways when you hear this latest report on giving from 2018?
Well, I will share with you, I was probably a little surprised that it was slightly down, but I think Peter has talked about this. There are some publications that will tell you that it's up, some will say it's down. But if we look at some of our data, and as you know, Kate does, to your point, Kate does the CASE BSC survey. We know that in 2018, 46.73 billion was raised, and this is actually over 7% increase. So the 1.1% decrease was somewhat surprising. And part of what we've tried to think about with our team here is, why do we think that is? And I think Peter touched on this. If you look at this report that we're having here with the 1.1%, it's also based on the calendar year. And I think with the soft fourth quarter, as we saw in the video, I think that's the reason. The data that we are doing with the CASE BSC is really looking at the fiscal year. And so I think the impact of trying to see what's going to happen in terms of the new state laws and new federal laws, we just haven't seen quite that impact. Other things we have said about the S&P, again, we know that it was a strong market. The overall economy did very well, and giving to donors has increased. If we look at some of the work that we've done on alumni giving, we'll see that alumni giving is actually up. I won't necessarily touch alumni participation, but alumni giving overall, that's increased. So I was a little surprised, but again, I think it just depends on how you're looking at that or how you might be splicing some of that data.
That's great to hear, and great to recognize that different sets of data tell us different things, and hopefully it all informs us to make good decisions and continue to do the good work. So thank you, Rob, for that perspective. Randy, you are joining us from what continues to be a very certainly volatile, interesting, disruptive healthcare sector in our country, and would love to now hear from you about your reflections on the data as it relates to your experience with Advocate and even more broadly with AHP.
Well, I would say that I'm not surprised to see the numbers relatively stable. Actually, I think that's good news for the health sector with all of the attention in the media currently, and I do expect that will be with us throughout the election cycle. I think much of what we're seeing in that volatility can be driven back to costs, everything from keeping pace with technology, rising pharmacy costs, larger deductible plans from employers, very real, tangible challenges that consumers are facing. And I think in this environment, it's good news that philanthropy to health causes is actually stable as opposed to going down significantly. We did have a good year last year. We were up considerably last year. But I think when cost is a driver, healthcare can be seen more as a commodity. And I think patients quickly become consumers in that setting. And I've seen this impact on the giving levels at the entry level to the mid-donor levels, especially across many of the health systems, whether it's rural community hospitals or larger academical medical centers. Part of the health model moving forward, I think, requires us to show how we're transforming how care is provided. It's no longer just in the hospital, no longer just treating the ill, but transforming care to keeping people well. And this is a major change from the traditional models that perhaps built many of the hospitals that exist in the communities where we have various locations. It's everything from putting names on the walls to funding the new surgical unit to now moving more towards the actual impact that those gifts can have, more issues-oriented as opposed to items-oriented. I think this has also sparked much of the merger and acquisition activity, including our own. And I think you put these new structures in place, new hospital presidents, new relationships that need trust to take hold, that can also be very disruptive. So it's a shift from the traditional needs-based model to one that is more issues-based, and I think Karen touched on that a little bit as it relates to what are some of those solutions that health entities really are called on to provide some new creative innovations for. It's no longer just artificial intelligence or 3D printing, so a neurological surgeon can print out the 3D example of the veins in the brain and test the surgery and actually try it a few times. It's more, what are we doing around population management and really addressing some of those issues where in Chicago we know in certain parts of our own geography that your zip code can mean more to your health than your genetic code. And what are we doing to really tackle some of those issues? But I think it also means, and the data shows that in our case, it's because it's more towards that consumer model, it's fewer donors at higher levels. And what are we doing to help others understand some of this transformational change, some of the challenges that we're facing? How much will gratitude for care or loyalty to a key physician bridge some of those areas? That's yet to be determined. But I think we're preparing within Advocate Aurora, and I do see that happening quite a bit throughout the health sector, in engaging activities around deepening the understanding of the challenges we're facing, but more also enrolling them in some of the solutions and making sure that they're lifelong partners in fulfilling some of those challenges that we know the sector will continue to face.
Thank you, Randy. So much to think about, and yes, probably some sense of relief, right, that the numbers are fairly stable this year. And also, I look forward to hearing more from you as we get into our questions about some of the issues that you've raised related to, fewer donors giving larger gifts and all of those sorts of things that definitely resonate with some of the things we're seeing across the sector. The next question that I'd like to go to is one that I think, everyone is trying to figure out the crystal ball question here, which is what effect is the revised tax code having on philanthropy in our country across individuals, businesses, and foundations, and even estates for that matter. 2018 was the first year of filing where we people were filing their taxes under their tax returns on the revised tax code. So it would be, I think, really interesting to hear from each of you about what you're hearing, seeing, probably a lot of qualitative, anecdotal feedback, but perhaps you have some data as well on this question. And Randy, maybe we'll start with you this time, if you don't mind, to share with us your crystal ball thoughts on what are we seeing from the revised tax code.
I think, like you said, it's the mid-tier to lower-tier donors that I think we're seeing most affected, and pretty quickly. Our attendance at many of our events are down. Again, those are the types of experiences where they're looking for a tangible return and they get their tax letter as far as how much is tax deductible. I don't know that that's so much a motivation for that type of giving, at least in our experience, and we're having to build in more experiences as opposed to just trying to create a value for the actual ticket price to some of those activities. So I think that the means of making the request is different. I don't know to what extent our direct mail appeals may be challenged, but I do know that our returns are down. So some of that could be, again, the media attention, the challenges that healthcare is facing as far as the perceptions as a commodity versus the focus that we're really needing to dive deeper in is around those mid-tier to upper-tier donors, $1,000 and above, and focusing on deeper relationships, loyal, lifelong partnerships that affect their health, but also the extent of the health of their community. So how are we bridging that gap to help them understand that it's not just a gala or a run, it's more about how do we help them stay healthier, how do we help their community become more vibrantly involved in the health of that community, and how does that reshape some of the care models and the opportunities that exist to really transform care across the nation, as well as where they seek it, and in non-traditional ways. It's not just the hospital. It's now more frequently outpatient centers, and it's community centers and partnerships with community organizations. So I think a lot is changing that will really go beyond just the tax code to determine how philanthropy will play a part in finding that cure for healthcare.
Thank you, Randy. Rob, what are you and your peers experiencing and hearing in the education sector as it relates to different donor behaviors or not, as the case may be, and giving to institutions of higher education and so forth?
We really think it's too early to tell. I mean, we've seen a lot of data that says this will be the impact or that will be the impact, but I just don't think we know yet. And I think it will probably take us another year to really see the impact or the lack of impact. But I tell you, one of the things I continue to push back when we have this conversation is I don't think people are giving because they're trying to get a tax break, right? They're giving because they're connected to your mission. They're connected to the work you do. It's often because of the great work that our advancement officers do, whether that's building the case that happens with our communications and marketing professionals, or the quality and the relationships that are built with our fundraisers, or understanding the importance of engagement with our alumni relations professionals. So to me, that's where I think we have to focus, at least for the next year, to kind of see what this impact is. But right now, I argue it's just too early to tell.
Fair enough, fair enough. Kieran, I know when we were speaking earlier about the conversation today, you, and even in your opening remarks, reflected a little bit on the extent to which you and your colleagues are getting more and more engaged in lobbying and policy work as it relates to the philanthropic sector. So would love to hear your observations as well on donor behavior, but then perhaps even taking it a step further about what you hear and what you see and what you're working on as it relates to perhaps further revisions to the tax code, and what's at work currently.
Definitely. I think, at this level where we are and the kinds of institutions that we're working with, we're not necessarily seeing a huge impact. And that is because I would say those individuals are the ones who actually do take those deductions, even with the reform in the tax law. And so I think this goes to the first question you gave me, Kate, where I realized I didn't fully answer, which is, donations to foundations. And I do think, even though there was a dip, if you look at kind of across the board, the trend is definitely on a upward trajectory. I think that I definitely agree with Rob in his sense that, it's really too early to tell. But I guess my feeling is, and I think of those here in the sector, there is a lot of concern about the tax reform, especially related to decreasing the number of individuals who could take the charitable tax deduction. It's a reminder when it comes time to do your taxes, even though it's not the only motivation, that this is also just a statement, I think, in our society of like how we want individuals to be supporting charity. So I think there is, and what I'd like folks to know on this call, there is really a very significant effort happening within the philanthropic sector by a number of the associations like ours, and it's being led by United Philanthropy Forum, which is a national entity or umbrella organization based in Washington, D.C. And there's been a lot of organizing around pushing for a universal charitable tax deduction, really making it much more accessible, trying to correct the revision and the tax reform law so that it really is encouraging giving to the fullest possible. I would say also for folks that there is also research underway, a new report that was just recently released by the independent sector, also the Indiana University School of Philanthropy, I believe the same entity that has worked on this report, as well as Wharton School of Business, that is looking at different policy proposals to make this fix related to the change in the tax law last year. And all of them have a certain benefit from what we are kind of managing right now. And I think their position as well is we really, if this is, we've had a very robust philanthropic sector historically in this country. We want to continue to push for that. And so there's, a real impetus around pushing for those changes and also for a universal charitable tax deduction. So, it's a lot of work that we're doing. I definitely think there's more organization that could be happening, and we are very much keeping our eye on this.
Yeah, so interesting. The sector has been awakened, to say the least, right? And I know a lot of this work has been underway for some years, and I think has just come in as such a sharper focus in the last couple of years. And I'm really eager to see where it all lands. And thank you for sort of sharing with us the latest on the universal deduction as well. Really, really helpful and important. Sarah Barnes, this might be a good moment for us to pause and see if there's a question or two from the audience.
Yes, and in fact there are.
Great.
So I will ask the question, and Kate, do you want to point it in the right direction?
Okay.
All right. So as nonprofits are working harder and harder to attract individual donors, what does the data tell us about any demographic shifts to assist in targeting individuals?
Interesting. So the role of demographic shifts as it relates to reaching out to and engaging more individuals in philanthropy. Rob or Randy, how do you feel about tackling that question to get started?
I'll flip you, Rob. I'll take
Okay.
heads, you take tails. We'll switch off next time. I think there's not a lot of demographic data, at least from what I've been able to look at so far in the early read. And I do think, though, that we can look at some of the patterns from previous years and how, if in healthcare, we're looking at a stable to declining market, and what does that reflect? I think we have to look at some of these other variables and what role are they playing in driving some of the actions that we need to anticipate that we can be more proactive around. So, if we're looking at mid-tier donors, those that may not necessarily in one calendar year meet the tax code for deductions, are there strategies that we can help them with their financial advisors to think creatively? And I know that DonorAdvised Funds is one of those areas where if you can aggregate gifts from more than 1 year in order to encourage more giving up front and provide for tax benefits, that's one creative strategy that I think will allow people to be a little more philanthropic around issues that are important to them. But as far as demographically looking at what divisions are most likely to give to different sectors, I don't know that there's a lot of information, at least that I've been able to see, that will give us that type of indication. Of course, we can look at different geographies, different levels of affluence, and what types of initiatives are they most likely to support. Some of that is there, and that does give us some guidance as to where we're spending our energy and also allocating staff resources to deliver on some of those opportunities. But I think it also needs to be taken into consideration with some of these other factors, as well as health disparities, and what does it mean to have health equity, and how do we address those demographics, leveraging those areas of affluence where we know there are philanthropic opportunities to provide for some of these solutions where we know there are challenges. And I think that's the ongoing issue that I'll be looking at the data to really interpret from a demographics perspective.
Interesting. Rob, do you want to say anything as it relates? I know, one of the big conversations in the higher ed sector, for example, is young alumni and millennials and Gen Z, and how they're behaving and thinking differently about giving, much more motivated by cause giving as opposed to institution giving, very driven by, technology in terms of how they're actually giving and engaging with nonprofit and charitable organizations. Anything you want to say about some of the things that you and your colleagues are thinking about and even experimenting with as it relates to engaging younger people in giving?
Sure, and I would like to start with, if you don't mind, Kate, actually with the first part of this question, because I do think we need to spend time on diverse philanthropy and understanding the impact of that. Diversity for us is people of color, it's women, it's young alumni, and so as we kind of think about that spectrum, the question becomes, what are we doing differently to engage these audiences? If you look at some of the reports, there's some great data out there that will tell you that people of diverse background actually give. There's a perception that people of diverse backgrounds don't give, but we know they do. They're not necessarily, in our case, giving to education. And so, one of the stats that you looked at was the decline in religion. If we look in the African American community, one of the things we know today is that the number of people who are African American, the number of them attending churches has decreased. So I'm not surprised at all to see some of the impact that that's starting to have on religion. And so the question is, how do we engage those audiences? In some cases, we could do it through our affinity groups. But again, part of it is, are we bringing these diverse groups, as well as our young alumni, are we bringing them to the table? If we look at many of our boards today, they're just not they're not diverse. And so how do we start to bring in that diversity of thought that they can provide? If we look at the millennial individuals, one of the things we know is that their wealth is growing at a pace much faster than many of us that are, in my case, are the X generation, right? And so we've got to think about how do we engage them now, because we often have an assumption that we make that we won't engage someone until they're 50 or 55. My fear is for our millennials, they will have their wealth by then. And it'll be hard to kind of then to shift them to make your institution an organizational priority because they've been engaged with other organizations. One of the challenges that we're seeing with many young individuals today is that they're investing in crowdfunding. They're now wanting to kind of pool their money because they believe that they can have a greater impact. We see so much information today about campaigns, but what's the impact of a person who's making a gift of $25? But now if someone says, well, I can pool my money together with 25 other people, and now we're making a gift of $2,500, that's going to have a greater impact. Two, now they also know where's their money going. So we're always in this battle of what I call restricted and unrestricted. But again, to me, those are the questions we've got to ask, and we've got to figure out and be able to tell if we want to engage diverse populations.
Thank you so much for sharing those insights. Kieran, anything you'd like to add or probe related to this question?
Just a ditto on what Rob talked about. I think I heard from a number of fundraising professionals who come to me actually kind of in confidence, a little frustrated that they don't think their institutions are really thinking much more broadly about how to approach their donor base. And I'd be interested in seeing, for the next study, actually, for folks, a correlation between the downtick in individual giving and the drastic shift in our demographics across this country. I mean, we're about to come upon the 2020 census. That will be a whole new set of data points. And, it's part our responsibility of how we are courting these donors and individuals from all different communities. And so if we only have this mindset of, here's where the wealth is concentrated, or these are the individuals who are giving, I think we're missing out on a whole other group of individuals who are basically becoming the majority in this country, which are mainly, communities of color and immigrant communities. And I know we're seeing that in trying to make an extra effort around, even within the philanthropic sector, as many of them are setting up family foundations and DAFs, like how are we making sure that there is both inclusion of how they're thinking about these issues, whether they're giving both abroad to things that they're connected to from their home country, but also see some correlation here in the U.S., as well as really trying to see how we can also benefit from their viewpoints on the world and making sure they're part of the larger infrastructure of philanthropy that we think is, important and helpful around supporting the work that we do with our members and within our sector.
Yeah. Thank you. Thank you for pushing our thinking in that regard. And I think you're, right on. So I'd like to come back to that actually in a couple of minutes and shift for a minute to this question around donor-advised funds and the continued explosive growth that we're seeing in the creation of and funding of donor-advised funds, both what we refer to as the commercial funds, those that are run by the Fidelities and the Schwabs and Vanguards of the world, and then those that reside within community foundations. And of course, we know that there are also a number of higher education and healthcare and even other institutions that have the ability to manage donor-advised funds. So, just as a quick data point, and to underscore something that was shared in the video, contributions to donor-advised funds in 2017 reached an all-time high. So this is just the new money going into donor-advised funds in 2017, exceeded $29 billion. And we also know that the payout rate from donor-advised funds tends to be higher than expected as well, and in 2017 reached 22%. So 22% of the funds that are held in donor-advised funds were actually paid out in 2017. DAFs are, controversial. Let's just say that they play an important role in the philanthropic landscape, and they also provoke a lot of questions and a lot of scrutiny. And Kieran, I think it'd be interesting to hear your view on the role of DAFs these days, particularly as they relate to community foundations, but perhaps even broader than that.
Certainly, and I think I was even mentioning earlier on, looking at the data points here in the Northwest of the most significant uptick in giving really came from, of course, family foundations, but then also community foundations, and a lot of this is related to the DAFs. And so I think I'd first start off by saying to folks on the call that, if you're not connecting with a community foundation in your local community, you absolutely need to. I think there's some major transformation that's taking place with community foundations across the country. I know that we're seeing this here in the Northwest with the work that we're doing. And because of the DAFs, and also I just think just the infusion of capital and assets and the growth of these community foundations, it's also just, it's really transforming community foundations in many ways. I think if anything, you're seeing very, very positive effects. And of course, Kate, we can talk about kind of some of the other challenges around DAFs that have been raised throughout. And I'd be very curious to hear what my colleagues are thinking about, or even folks on the webinar today. But I think, on the positive end, it is allowing community foundations to show up in really incredible ways in their communities. I mean, to be much more responsive around community tragedies, around disasters, about money that they can get out the door really, really quickly. I think, another piece of this is how they are also the work they do with donors, and really allow, giving them the tools around what their giving should look like, the impact that we would want to have in communities, really forging a way for them to become lifelong philanthropists and really engage community citizens in the communities they care about. And I would say that, this is also just creating this dynamic of community foundations wanting to try to be much more strategic and much more impactful in their giving. And they're creating more partnerships with local and state government. They're wanting to do much more authentic relationship building with the community leaders and organizations, which is to my point for folks on the phone around, there is this appetite to really build these strong relationships. And so I would really encourage folks to do that if they haven't. And then I'll just mention this other data point, which is from the Columbus Survey, which documents donations to and giving by community foundations, showed that and this is 2017 data, that the top 100 community foundations paid out $1.1 billion more in grants in 2017 than in 2016. And that was partly due to the DAF investments, but it was also a lot of leveraging that many of those foundations actually did with those investments and other resources they were able to pull. So it's having this multiplier effect, which is, I'd love to also, if folks are seeing that in their local communities, to share that as well. So I know I didn't talk about the other piece around DAFs generally. I'll leave that for kind of maybe, I feel like it's a larger conversation, if that's okay.
Yeah, that's a whole nother webinar. Yeah, thank you. No, that's really interesting, and we've been watching this metamorphosis transformation you talk about in the community foundation arena with great interest and great hope. Rob, over to you in terms of, your thoughts on DAFs generally, and any observations or thoughts you have on community foundations would be welcome as well.
Yeah, well, and what I would say here is just really to support some of the data points that you've given, that Karen shared and that you shared as well, Kate. We do the case BSC, and last year we had about 871 institutions that participated in it, and about 46% of them replied to our optional question about DAFs. And we have found, just to give you some of these stats, the total value increased by 65%. The total number of contributions increased by 18%. And the average value increased by 39.5%. So again, supports that this is something that we definitely need to look at. and to think about as we think about our overall all programs that we're managing.
Really remarkable. Such an important force in the field, no doubt about it. Randy, what's been your experience working with donor-advised funds and just more broadly how they're affecting the health giving in the healthcare sector?
I think they're becoming more commonplace as a strategy used in some of the more significant gifts that we're seeing. They're largely being used by the affluent to aggregate some of their giving towards specific causes in a time frame that then allows them the flexibility to make those decisions later. And, I think the video itself just was striking to the extent that DAFs are impacting the level of individual giving. Is it displacing individual giving, or is it just happening in a different way with different vehicles being used for whatever reason might be appropriate for that donor to consider? And I think, that's interesting to think through, because if we think of it more as a resource and how can we creatively leverage the opportunity that clearly is happening with or without us, what would we do differently to educate some of our donors around what role we could play, perhaps in partnership with a community foundation around a specific issue? I think there's another unanswered question as it relates to DAFs, is the individuals that are making the gifts to these donor-advised funds, are they also indicating beneficiaries of their resources at their passing, or does that then defer to the community foundation to address issues on their behalf? And I think that's an ongoing issue that one that should happen at the individual conversation level around those that have an affinity for a specific cause.
Thank you. Sarah, I'm wondering, I have at least one more question for the panelists. I also just want to make sure that if there's a great question from our participants, that we've got room and time for that. Anything that you want to pitch to the group at the moment?
Yeah, this one is in terms of just alternative fundraising efforts or channels. But so the question is, I'm wondering if there's any consideration going to the quote-unquote GoFundMe and other types of donating, like on Facebook.
So the question of GoFundMe, Facebook, maybe more broadly the field and sector of crowdfunding. Rob, you shared an interesting story with us in preparing for the webinar today about something that you learned about and experienced recently at I think a gathering of leaders from HBCUs and I think some crowdfunding experiments, if I'm remembering this correctly.
It was. It's one of the challenges that, in this case, these were HBCU deans, business deans that we were meeting with, and they noticed that a lot of their alumni now are not giving to the institution, or in this case to the business school, because they've opted to pool their money with other individuals. In some cases, that's family members, and I think we talked about this a little bit. So I think that's something that we've definitely got to look at. I think another one is the Giving Tuesdays. I call them Giving Tuesdays, are extremely popular right now, and we're finding that our alumni are giving a lot of money to the institution on that day and in that kind of window of time. And so how do we support that when you're not obviously doing it during those windows?
Randy, any observations from this around this kind of donor behavior, collective giving, cause giving, kind of giving a little bit outside of some of the traditional channels in the healthcare sector that you're seeing or not seeing, for that matter?
Sure. So I think it's no surprise that people resonate with a story that's told well, and a compelling story requesting their support gets a response. And I think you see that in some of the information from the survey findings, especially around international causes and the uptick that they've received in funding support. I don't know what some of the drivers may be for that, but I do think that it is part of the technology that's available at the fingertips of every one of us as we look and search the web for different stories. At a click of a button, we can support a cause that's halfway around the world, or a specific disaster that we know is in need of specific funding. So, it's no different when it's a personal challenge that a family is facing as a result of a healthcare instance, and they're looking to, out of gratitude, provide support to a physician, a specific program area, or maybe even a specific hospital. And through the means of technology, we can allow them to set up their own homepage, their web page with their circle of influence, and largely through these third-party connections generate some philanthropic support around their cause and their story. And we can help them tell those stories in an impactful way with a great deal of compassion. But I do think that it's just the broader accessibility to information, the manner in which stories can be told for a broader and perhaps viral audience that in some cases is generating some of these returns that we haven't seen previously.
Thank you. And Kieran, just want to give you the opportunity if you have any, again, thoughts, observations on this important question of how people are engaging with giving behavior, even if it isn't through some of our sort of traditional, just to say, it's through some of the newer channels and technologies that are available to us.
Nothing to add right now. I think Randy and Rob really covered some really good points.
Terrific, terrific. Thank you. So I would love to ask each of you to share your thoughts around my words, a fairly alarming trend in our field that is currently sort of popped up in the philanthropy panel study reported by the Indiana University Lilly Family School of Philanthropy, which just simply says, and we saw this in the video, that the share of Americans who are donating to charity dropped nearly 11 percentage points from 2000 to 2014. What are we going to do about this? Each of you have talked a little bit about this in terms of the importance of engaging with a broader array of donors, more diverse donors, and communities of color, immigrant communities, meeting people where they are in terms of the ways that they want to give. But thoughts that you have, given everything that you've already shared with us today about how we might reverse this trend and address this trend. And maybe I will ask Kieran to share some thoughts first, please.
Sure. I think this has been, obviously it's challenging to look at these numbers and say, okay, what's happening and how to get behind, try to understand what's behind it. And I think, like you alluded to, Kate, there's a lot of factors. There's both kind of, I think there's some of these demographic shifts and really kind of a hard look for all of us around how we're thinking about our fundraising. And I think there's whole transformation with technology that my colleagues have talked about and are much more versed than I am, and then thinking about, what that means for their specific field. I would say that, some of these older models like workplace giving, that used to be kind of the cornerstone. I worked in the federal government, and it was at the Office of Personnel Management where the CFC campaign was like this massive campaign among all federal employees, more than 2 million. And there's been a trend over 10 years of a significant downtick. And so I do think we need to be thinking, and I'm sure folks are, about, I don't think that we're becoming less altruistic. I think it's just that there's lots of things at play. And I do think there's a bit around the tax reform that took place last year. But I'll mention just two or three things that I'm seeing kind of at the in the wealthy donor space. I just wanted to flag for folks on this call to keep in mind. One is, seeing a lot of, I think what Rob is alluding to as well, and it happens at all levels of giving, which is folks coming together to really maximize impact. So on one platform, you're seeing, for example, the Gates Foundation has been really pushing this effort to use the online platforms to cultivate more giving circles. So before, where you had these giving circles sitting within community foundations or other affinity-related philanthropic organizations, now there's an actual platform where you can set up a giving circle, pool your money on a whole set of issues, or organize yourself based on all different ways. And I think this is this idea of maximizing your $2,500, $1,000, $2,000 gift in a way that you feel like you can have more impact, but that you can also be more involved in the giving. I think there's this piece around that I don't know if we've talked about as much, is that, folks just don't want to give. I think they really want to be engaged and involved in other ways. And then I think you're also seeing this with, so this actually started here in Seattle, the Social Venture Partners, SVP as they're known here. They now have about 25 similar type organizations around the world. And it was really set up to bring in donors to come together, pool their money, but also do a lot of training with the donors of how they can actually use their other skills and their day jobs to bring to the nonprofit sector. And the model's been very popular. They now have an SVP International that's actually set up to really propagate these type of entities. And I would just encourage for you to look it up and see if there's one close to you, because they really are trying to build a different type of relationship with the nonprofit sector. And then finally, there's another effort here started by the Rakes Foundation here in Seattle called the Giving Compass, which is another online platform around really driving wealthy donors to their site to help them think about impact and how they can have impact with their money, and using actually the advice and research of other individual donors and other entities to really give them a place where they can find this information and make like a very solid, intelligent choice about how they might want to think about their giving. And I would just encourage folks to go there and see how that information is being presented, what these donors are talking about in a way, because I really do think it's driving towards this idea around impact. So this is all to say, I think we can adjust this trend. I just think it's a way of, I think it's just important that we see these data and say, okay, what do we need to be doing differently?
Yeah, double underline, what do we need to be doing differently? Thank you so much for that. Rob, thoughts do you have on this trend and what we need to be doing differently?
So what I think we need to do, what we need to be doing differently is really extending the definition, I believe, of giving. CASE right now is doing some great work in the alumni engagement metrics that really looks at in terms of how are people engaged, that looks at people as volunteers, the experience, philanthropy, and communication, understanding that people are giving more than just money. And I think we've got to include these elements as we think about giving, because that to me is what will make people inclined to support your mission more, and as a result, to give more as well.
Randy, the last word.
Well, I think I'll go back to where I started. It's a time of turmoil in healthcare with so much change going on. I think a lot of what we will hopefully arrive at is more conversations that are deeper with individuals that have an interest not just in providing for the needs of their community or their own personal health, but more importantly, how are we shifting to resolving issues, and what partnership can they provide in providing some of those innovative solutions? So it's more, are we a deserving partner to fulfill their philanthropic aspirations? And sometimes that's identified through gratitude for care already provided. Perhaps it's achieving a solution to a health issue, or perhaps even addressing an issue in a geography where we know there's disparities. But redefining the role of health as opposed to simply healthcare will be pivotal for this sector in determining what philanthropic solutions we can create, and how many individuals, I think, is relative to how much of an impact we can have. And I do think that we tend to look at the numbers of donors or the total dollars raised as opposed to the issues addressed and the impact felt. And I really do think that that's part of the transformation as well.
Well, that is just about those final three comments there, the best way to wrap up our discussion today. Karen, Rob, and Randy, I want to thank you from the bottom of my heart for joining us today, for provoking just some new thinking, sharing your reflections and your experiences with us, and helping us to strive always to do better. And thank you so much for your participation. Peter, over to you.
Thank you, Kate. Great job. And thank you, Karen, Rob, and Randy. Really love the dialogue. That's it for today, folks. We really want to thank you for taking the time to join us. We hope that you learned something valuable from the data and from the dialogue that you can use going back to the office. We do ask that you strongly consider purchasing the research. You can see on your screen how to do that. If you go to www.givingusa.org and use the code Campbell, you'll get a 30% discount off any Giving USA products that you choose to purchase. The reason we're stressing this is it helps support the research. And we have found that there are tools that you can use to talk with your board and some of your staff and donors about philanthropy and spark dialogue like we've had today. So we do hope that you'll choose to purchase the research with that 30% discount. Thank you again, and we look forward to seeing you for this webinar again next year. And please go on our website to see other webinars that we have. We're having them all the time on a range of interesting topics. Thanks very much, folks.
Thank you.